Care, the Aging, Voiceover Part 2. This is Martha Olson. As we continue on looking at our review for the final pain control, when we look at a PCA pump, the basal versus the bolus. The basal, remember, gives you a little bit at every hour, and the bolus is when the patient pushes the button to get pain relief. Both of them have the serious complication of respiratory depression, but when we think about the older adult and the fact that their kidneys and liver don't metabolize as well, the basal oftentimes can give them too much medication, because even when they're sleeping, it's still giving them a small dose of usually morphine in that PCA. Interventions for the overdose would be your Narcan, your for respiratory depression, and then your dose is usually a 0.4 milligrams, but it has to be repeated because there's only a short window of time that Narcan actually works, but the narcotic hangs on a lot longer in that person's body. So review the basal versus bolus with your PCA pump and the use of Narcan. As far as skin breakdown, the staging, remember stage 1, the skin feels boggy, it's intact, a little red, and that is where we need to really intervene, because stage 2, that skin then has opened up. Stage 3, you're seeing tissue, and a stage 4 wound, you're able to see down into the cartilage, the tissue, and the bone. All very serious, all very preventable with good nursing care. Our Braden scale gives us the risk factors for skin breakdown. We know that diabetics, because of the neuropathy, are at higher risk for skin breakdown, and so we take special precautions and interventions for them. The Braden scale, remember, the higher the score, the better. It's based on 5 areas that you look at or rate them. And the Braden scale is, there's a full page of that in the Potter and Perry. If it's been a while and you need to review that, it should be something that you've done in clinical every semester, and also at the long-term care facility when you get there for clinical. When the dietitian comes, and when I teach nutrition, we often look at that protein, because that's what builds tissue. The vitamin C and zinc are 2 specific vitamins that assist in the healing of wounds. We supplement a lot of times with the older adult that has skin issues, and we're trying to heal either a surgical wound or a decubiti that they have developed. Our lab values that go with that obviously are oxygen saturation, to get oxygen out to those tissue, but we also look at albumin, because a low albumin can cause edema and makes that skin very fragile because it's stretched with all the excess fluid. Blood sugars to control, obviously, for the diabetic. Our iron, because of the anemia, and then our interventions are to keep that skin warm and dry, to turn them often, to use pillows and blankets and different things to keep the skin from breaking down, or the bony prominences from resting upon each other like the knees. So that is review and different things you'll want to make sure that you know the staging of the wounds. If I described a wound, that you would be able to say that's a stage 1, that's a stage 2. As far as your diabetics, we know that oftentimes they don't have the typical or classical symptoms of diabetes, and so we check them. Type 2 is on the rise, especially with the increase in obesity in our society. Our diabetics then have some specific complications that go with that, the retinopathy, the loss of vision, so we think of safety for them. And many of the diabetics that I used to see when I did diabetic education, they came from the eye doctor. He would notice the changes in vision, and they would check them for diabetes and find it that way. The neuropathy is very concerning because of the changes to the skin, the changes to the CMS. They need to be told to wear shoes at all times, or slippers, because if they step on something, they won't feel it. Remember the safety with the water, no hot water bottles, no electric blankets, because they easily burn. With the neuropathy, they don't feel that it's too warm, and they need to remove their feet or extremity from that heat. And again, the Braden scale helps us to know about that risk for skin breakdown. The nephropathy, for the kidney damage, the toxicity for the medications, your BUN, creatinine, specific gravity, or just a couple of the lab values that correlate with the neuropathy for that diabetic. When we see the endocrine chapter, we know that the testing is fasting blood sugars, your long-term A1C that tells you the average blood sugar over the last 3 months or 120 days, and then the oral glucose tolerance test, not often done with the elderly, but it is another one of the tests that is talked about. The polydipsia, polyuria, and polyphagia are the symptoms that oftentimes go along with that, but again, for the older adult, they oftentimes present in atypical ways. Osteoporosis, your risk factors are your small-framed female, especially postmenopausal, lack of weight-bearing exercise, some of the medications that put a person at higher risk for getting osteoporosis, we did in our case study. A lot of your seizure medications, your steroids have high risk for osteoporosis, and the DEXA scan is the test that helps us to know. There's no prep with the DEXA scan. You simply go to x-ray. I believe they look at the hip or the thigh bone and just do a very non-invasive scanning of that to give us a score of their degree of osteoporosis. Vaginitis is something with the older female that your mock book talks about. We know that due to the changes in hormones, there's less vaginal lubrication. The alkaline pH low because of the estrogen levels. For the woman, remember the treatment for that, no tight clothing because of the high risk for getting like a yeast infection, no douching. They need to be very careful to not use things like KY jelly. They need to make sure they're using something water soluble. Congestive heart failure is very concerning as we look at the pump failure and causes of that. With even just a little bit of congestive heart failure, it can affect the left side of the heart that, remember, backs up to the lungs, and we see changes in O2 sat, and the lungs sound like they have some rales and rhonchi. For the right-sided heart failure, we see a lot of edema, we see a lot of jugular vein distension. Our dyspnea is our priority because that's airway. And then your lab value that goes with congestive heart failure is your BNP. It stands for binatriuretic protein. With that BNP, it is elevated greater than 100. Many of your older adults, excuse me, that come into the ER with severe congestive heart failure exacerbation have a BNP of 800 or more. With Lasix and oxygen and other interventions that we do, we can see that BNP fall. And typically it's not back to a perfect less than 100 at dismissal, but much improved from when they're admitted. They're frothy at the mouth, very short of breath, and they always want to sit up in a high Fowler's position to assist in their breathing. Excuse me. Your BPH is your male prostate issues that we often see with the older adult. Review the types of catheters that we have. We have the straight cath, we have the Foley, we have the three-way indwelling cath that would be used with CBI for your TERP patient. And then for the male, the Coude is the one that's tipped a little bit at the end that helps get past that enlarged prostate. You do not have to have a physician's order to initiate a Coude. You just have to have the physician's order to catheterize. When we look at the TERP surgery, remember that pre-surgical we want to make sure that their hemoglobin and hematocrit are appropriate, because with that roto-rooter surgery to decrease the size of that overgrown prostate that's keeping them from being able to urinate, they will have a lot of bloody drainage following that surgery, and you're going to be looking at the color of the urine in the tubing and not the bag, because the bag is a collaboration or all of the urine that's come out, but your most accurate amount of bleeding is going to be noted from that tubing. With your TERP surgery, remember they have that CBI running, and you initiate the rate of flow based on the color of urine. If it's more red, you're going to irrigate quicker. If they're clotting, you might need to have that running a little quicker. And then you have to do your intake and output based on subtracting the amount of CBI or fluid that has gone in to irrigate that catheter. Lab values are going to be your hemoglobin with the loss of blood, PSA, and is not really indicated at that point, because with the manipulation of that prostate, we know it will be a very elevated PSA result. You can bladder scan a patient if you think that there is a clot in there that is keeping them from eliminating all of that, and you need to watch your patients that have had a TURP very carefully, because if you have all that fluid running in and they have a clot and it's not able to eliminate that through the catheter, you will have a very serious fluid in the bladder issue in a very short period of time. As we look at the distended bladder on the older adult, my experience was an older man that we changed his attends throughout the day, but it was a dribbling. He was not really urinating. He was overflow urine into that. Very confused when the doctor came in. He bladder scanned, had over 1,000 in his bladder, so we had to catheterize and remove urine very slowly from his over-distended bladder. So my advice to you is to bladder scan early. You don't have to have a physician's order because it's non-invasive, so that if you have, especially a male that has some prostate issues, you're not letting them get to the point of having that over-distended bladder before you find out. With cancer, we talked about some of the theories in class. We know that cancer can be caused from many things, such as exposure to things like smoking, asbestos, melanoma from the sun. It can also be genetic. There is a lot of genetic predisposition to that. As we look at cancer and the death and dying, we know that there are specific medications that are more appropriate for cancer pain, and we don't worry about addiction issues at that point, because our goal in hospice is to keep them comfortable. As a mandatory reporter, make sure that you think about the older adult. Are they a victim of abuse? And remember, there are many types of abuse. It's not just physical, where you will see the bruising and some of the physical changes. There can be emotional abuse, financial as well, and as a mandatory reporter, all of those become very important for us to know and report. When we look at some of the tools for using to identify problems with the older adult, the Braden, remember, is for the skin breakdown. The fall risk looks at things like their current medications. Have they had a recent fall? Do they have cognitive or sensory changes that we need to be aware of? Fall risk is done in the hospital on admission, and then for the older adult, I believe every day it fires in your charting. The depression risk factors need to be assessed. Your aspiration risk is also a tool that is done on all admissions in the hospital, and I believe into the long-term care. You're looking for pocketing. Do they keep food in their mouth for a longer period of time? Do they have wet-sounding lungs? Have they had a stroke? Those are all kind of red flags for that risk for aspiration. And it's not just your stroke patient. We have many older adults that do have risk or aspiration. And then the spices is one of the review tools that you'll be looking at in clinical, and it looks at many different areas. Spices is very specific for the older adult, and looking at all of those areas so that we can get an overall picture of their healthcare needs. See me if you have any questions related to these. The references that we use, mostly the mock, which is your required book, but also review from Potter and Perry on some of the things that are not found in mocks, such as the comparison of the depression, dementia, and delirium, as well as the oxygenation unit with the types of oxygen equipment, and the elimination unit with the types of catheters and size of catheters that you may consider. This is the end of the review for the 50-point final. If you have questions, let me know. Thank you, and have a great day.